Hi, this is Bill again. Lecture Burst, chapters 38 and 39. Um, to start this off with, I wanted to talk about gastrointestinal and endocrine disorders, and these are the key terms. Knowing these terms will help you with these diseases that occur to children, and some of them follow them throughout their lives. So you need to make sure that you know what you're doing, what you're talking about. Types of malnutrition. Malnutrition is all over the world, even in the United States. We have malnutrition, children that are malnourished, protein malnutrition. Um, they have the weird one there. Vitamin D deficiency. Just about every single person in the United States in the northern region has a vitamin D deficiency. A lot of children are vitamin C deficient and don't even know it. So, um, Kwashiorkor is a severe deficiency in the area of protein. The term means the sickness of older baby gets when the new baby arrives. This type of malnutrition is most common according to the World Health Organization, where um, maras, marasmus is a deficiency of both calories and protein. These children are extremely ill. Vitamin deficiencies are not as common as they used to be. Vitamin D is recommended at 400 units daily for children. Some of the sources are fish oil, milk, um, and most vitamins have the 400 units. So, vitamin C deficiency causes scurvy. A variety of fresh fruits and vegetables are a good source of vitamin C. Boiling and cooking the food decreases the amount of vitamins in them. So we can go on from there. Milk allergies, lactose intolerance, that's something that occurs occasionally. Um, Symptoms include diarrhea, vomiting, colic, irritability, respiratory issues, or ischemia. Lactose intolerance cannot digest milk. They lack the enzyme to do so. Symptoms include cramping, abdominal distension, and flatulence and diarrhea. And the flatulence is usually quite pronounced. Milk allergies is the most common in young children with food allergies. The children are placed on a soy based or meat based milk substitute. I've never seen meat based, but it's out there. Vitamin D to replace what they are not getting from the milk substitutes. Some of the names of these products are Isomil, Norsoy, Prosobi. I recognize those from my time working in the normal nursery. Children that are breastfed for the first 6 months seem to have less of a milk allergy unless they are strong family history. Um, so we can go from there. Celiac disease. Now, celiac disease, these definition is used to designate the complex malabsorption disorder caused by a defect in the metabolism of wheat and rye glutens and interfere with the absorption of fats in the intestines, um, resulting in steatorrhea. So, fatty stools again. So, fatty stools, that was also mentioned in cystic fibrosis. Chronic diarrhea, foul, bulky stools, and progressive malnutrition, anorexia with fretful, unhappy disposition. They need to be on a gluten-free diet for the rest of their lives and low-fat diet. If the condition is severe, they are placed on skim milk, glucose, and banana flakes. Lean meat, pureed vegetables, Fruit. Forbidden types of food include wheat products, malted milk, some candies, many babies, baby foods, breads, pasta, pastries, cakes, biscuits, unless made with cornmeal or flour added, or flour. Um, but most of the flour in the United States is wheat based. Addition of vitamin D and vitamin A are needed to supplement the deficiencies. Gastroesophageal reflux. This happens when the lower esophageal sphincter, the LES, is to relax to allow stomach contents and allows stomach contents to reflux up into the esophagus, causing discomfort and burning sensation. A lot of adults have this also. Treatment is making sure that the child is upright positioned during and after feedings. H2 receptor antagonists are given, such as Zantac. Surgery is sometimes done called a Nissen fundoplication, where the upper portion of the stomach is wrapped around the esophagus. Pyloric stenosis. This is interesting. Manifestation is a projectile vomiting. Is outstanding symptom from force of pressure being exerted on the pylorus. Vomit usually contains mucus and ingested milk. Infants is consistently hungry. Nursing care is to avoid dehydration by giving IV fluids and ordering an accurate INO. Okay. Hirschsprung's disease is aganglionic megacolon. Occurs when there is an absence of the ganglionic innervation of the muscle of a segment of bowel. In newborns, failure to pass meconium stool within 24 to 48 hours may be a symptom. In infants, constipation, ribbon-like stools, abdominal distension, anorexia, vomiting, and failure to thrive. Young children are usually seen in the clinic after parents have tried over-counter laxatives to treat the constipation. If untreated, other signs of intestinal obstruction and shock may be seen. Fever, explosive stools, and depletion of strength may be seen. Barium enema and rectal biopsies, anorectal manometry measures the pressure of the anal sphincter. Treatment, surgery to remove the impaired part of the colon, and the reanastomosis of the intestines are performed. Intussusception is another a slipping of one part of the bowel into another of the intestines, often seen in ileocecal valve. The mesentery, a double fan-shaped fold of the peritoneum that covers most of the intestines and is filled with blood vessels and nerves, is also pulled along. Edema generally occurs in boys between 3 months and 6 years of age. Frequently decreases after 36 months, so after 3 years of age, the occurrence of this decreases. Can be spontaneously reduction. Onset is usually sudden. May have a fever as high as 106 degrees, and you have to watch out for any kind of seizure activity with a temperature that high. As it progresses, child may show signs of shock, sweating, weak pulse, shallow grunting respiration. Abdomen is rigid. They have blood, mucus with no feces are common about 12 hours after onset of obstruction, called gelatin, current jelly stools. This condition is an emergency. Diagnosis is determined by history and physical exam. This is a picture of it, what it looks like, and it can be quite painful and needs surgery right away. Okay, vomiting results from a sudden contraction of the diaphragm and the muscles of the stomach. Persistent vomiting requires intervention because if results in dehydration and electrolyte imbalance. Continuous loss of hydrochloric acid and sodium chloride from the stomach also causes alkalosis. Nursing care: carefully feed and burp infant. Place infant on the side after feeding to prevent aspiration of vomiting if vomiting occurs. When an older child vomits, turn the head from one side to one side and offer emesis basin. IV fluids must be ordered, slowly introducing foods to allow the stomach to rest. Failure to thrive. Now, failure to thrive is something that does not happen very much, but usually if it does, failure to thrive, to gain weight and often loses weight, can be caused by physical, organic, pathological threats such as congenital heart or malabsorption syndrome. Non-organic failure to thrive is from a lack of parent-infant interaction resulting from environmental factors or neglect. Often admitted to the hospital, it's due to multiple factors. There may be a disturbance in the mother-child relationship. Infants suffer from inability to establish a sense of trust in caregiver. Coping abilities are affected by lack of nurturing. Preventing the environmental failure to thrive consists chiefly of social measures. So there's all kinds of issues that can go on with that non-organic versus organic failure to thrive. Appendicitis, most common reason for emergency abdominal surgery. Tenderness in the right lower quadrant, known as McBurney's point. Guarding of that sign, when you push down, it sort of relieves the pressure, but when you let go rapidly, it causes more pain. Rebound, that's what they call rebound tenderness. Pain in left thigh, while on lift thigh, I think it meant left thigh, while in supine position, right lower quadrant pain. Diagnosis can be made by blood test, abdominal x-ray, CT, ultrasound. Treatment is surgical intervention. Typically requires nursing care to be the same as most abdominal surgeries. Okay. Worms, pinworms, enterobiasis. Worm looks like a white thread, lives in lower intestines, but lays eggs outside the anus. Eggs become infective within hours and become being deposited. You can do the Scotch tape test, where first thing in the morning you take some tape and you touch the anus, and if it comes back with little white eggs on them, that person has pinworm. Okay, roundworm, seen more in the southern states and among immigrants and migratory workers, caused by unsanitary disposal of human feces and poor hygiene practices. Eggs can survive for several weeks in the soil. A child eats the soil, eggs develop into larvae in the intestines and penetrate the intestinal wall. So it's always good to, especially like right now what they're saying, wash your hands frequently and often. Okay, poisonings. Goal of treatment: remove the poison from the system, from the environment. Call the Poison Control Center, 1-800-222-1222. Everybody should have that in their phone. Okay. Um, Many over-the-counter medications are considered harmless, but parents but can by parents, but can be deadly to toddlers and small children. Keep all medications prescribed or otherwise, including herbal supplements, out of the reach of small children. Poisons commonly encountered in pediatrics is acids, alkalines, medications, cyanide, ethanol, petroleum distillates, carbon monoxide, lead, um, insect stings, snakes, and poisonous plants. Um, Here's a list of some of the poisonous plants that you don't want to have in your garden right now, especially if you have small children, because they will go out and possibly eat them. Over the counter medications that are poisonous, Oragel. We use Oragel for toddlers when they start erupting their teeth. Camphor, Vicks Vapor Rub. We put that on their chest, but it's poisonous if they eat it. So Lomotil, blocks them up. Oils of wintergreen, things like that. Lead poisoning, plumbus. The city of Detroit has a huge problem with this in their water supply. Results when a child repeatedly ingests or absorbs substances containing lead. Their water was poisoned with lead. Incidence is higher in inner city tenements. Children who chew on windowsills and stair railings, ingest flakes of paint, putty, or crumbled plaster. Eating non-food items is called pica. Can have a lasting effect on their central nervous system and the brain. Mental retardation is also possible. Foreign body. 80% of all ingestion occurs in children between 6 months and 3 years of age. May take up to 6 days for it to go through if they ingest something. Caution parents not to use laxatives and to maintain a normal diet to avoid intestinal spasms. Diabetes mellitus. There are 2 types of diabetes. It is a metabolic deficiency of insulin. Type 1 is destruction of the pancreatic beta cells, the Isles of Langerhans. Type 2, body fails to use insulin properly, combined with insulin insufficiency. Contributing factors for cardiovascular disease, hypertension, renal failure, blindness, and stroke. Risk factors include genetic factors. It runs in families and causes type 1 and type 2 diabetes. Toxins can also cause the destruction of the beta cells in the pancreas, leading to type 1 obesity, physical inactivity, and triglycerides greater than 250 milligrams per deciliter, and hypertension can lead to type 2 diabetes. I am a type 2 diabetic, and it runs in my family. So my grandmother had it, my mother had it, my brother has it, my sister probably would have had it, I have it. So it's very much in my family. Types of insulin: rapid acting, Lispro, Humulin, Novolog. 15 to 30 minutes. I'll let you read these. Complications: DKA, diabetic ketoacidosis, is an acute, life-threatening condition with hyperglycemia, 350 milligrams per deciliter or greater, ketonuria, glycosuria, ketonuria, and acidosis, pH of 7.3 and bicarb of 15. Kidney failure, neurological complications, eye disorders, including blindness. Diabetes is the number 1 cause of blindness in the world. Question: Which of the menu selections are best for a child with celiac disease? Okay, corn tortilla and fresh fruit is the one I have down. How are pinworms diagnosed? Okay, I told you that. Let's see the Scotch tape. Okay, genital urinary conditions. Got some terms again for you. That's going to help you get through this and understand more and more about it. These are genital urinary system, consists of 2 kidneys, 2 ureters, the urinary bladder, and the urethra. So we're all set up the same on the inside. Sexual abuse of children may be manifested by behaviors such as urinary frequency, excessive masturbation, incorporations, severe nightmares, bedwetting, and so on. Phimosis is the narrowing of the preputial opening of the foreskin, prevents foreskin from being retracted over the penis. Corrected by circumcision, forcible retraction of the tight foreskin is avoided because it can lead to paraphimosis. Foreskin cannot be returned to the normal position. Swelling and impaired circulation causes by constriction. Hypospadias or epispadias. Hypospadias is a congenital defect in which the urinary meatus is located on the lower portion of the shaft. More common may be accompanied by chordae tendineae or a downward curvature of the penis from the fibrous band of the tissue. Epispadias is urinary meatus is on the upper surface of the penis, less common. In mild cases, surgery is not indicated. Surgery may be indicated if child will not be able to stand to void, or if it may cause psychological issues and difficulty with future sexual relations. Surgery is usually performed around 18 months. These are pictures of where these happen and that. So there's all kinds of degrees. Okay, urinary tract infections are more common in girls than boys. Most caused by Escherichia coli. Signs and symptoms are age dependent: infant fever, frequent urination, foul smelling urine, persistent diaper rash. Older children, urinary frequency, pain during micturition, onset of bedwetting in a previously dry child, and abdominal pain may be present. Treatment: children under a year usually hospitalized with IV antibiotics. Older children are treated at home with oral antibiotics. Parent teaching stresses the need for proper amount of fluid to maintain sterility and flushing of the bladder. Undescended testicles. Cryptorchidism. Testicles fail to lower into the scrotum. Unilateral form is more common. Testes are warmer in the abdomen. Sperm cells begin to deteriorate. If both testes involve, sterility can result. Hormonal management before surgery consists of the administration of the human groronic gonadotropin. That's a hard thing to say sometimes. May precipitate descent of the testes into the scrotal sac. Orchioplexy improves the condition for fertility rate among these patients may be reduced, increased risk of other things. Okay. Nephrotic syndrome, also known as nephrosis, more common in boys than girls. The cause is not known, but for sure, but thought may be that it is from the thymus and the T cell dysfunction. Age is usually 2 to 7 years of age, 80% favorable prognosis. Nephrotic syndrome is caused by different disorders and damage to the kidneys. This damage leads to release of too much protein in the urine. It is characterized by swelling around the eyes, ankles, and then becomes generalized swelling. The abdomen becomes swollen, and the child then starts to show the following signs: pale, irritability, listlessness, poor appetite, goal controlling edema, diet well balanced, nursing care, positioning, monitoring INO, weight, and protection from infection. Acute glomerulonephritis. The pathophysiology is AGN, formerly called Bright's disease, allergic reaction to group A beta hemolytic streptococcus infection. Antibodies attack the nephrons after the infection. Usual age is 3 to 7. Manifests 1 to 3 weeks after the strep infection. Periorbital edema. Urine smoky brown or bloody. Urine output decreased, BUN is elevated, and hyperkalemia. Treatment: keep the child from being too active. Urine examination regularly. Prevent the child from becoming chilled, overly tired, or exposed to infections. Nursing care is supportive, prevention of infection, accurate intake and output, frequent vital signs. Wilms tumor is one of the most common malignancy in early life. 2/3 of the cases are discovered in the first 3 years of life. Treatment is combination of surgery, radiation, and chemotherapy. No palpitation of the abdomen for these children so as not to spread the tumor. Wilms tumor most often occurs in just one kidney, though it can sometimes be found in both kidneys at the same time. Improvements in the diagnosis of Wilms tumor have improved the prognosis for children with this disease. The outlook for most children with Wilms tumor is very good. Okay. Hydrocele is an excessive amount of fluid around the testes. It usually resolves itself by age 1. Treatment: most of the treatment is for the child that has the surgery. Care post-op includes dressing checks and reuniting the family as soon as possible. Impact of urinary and genital surgery on growth and development. Separation anxiety is huge for toddlers and school-age children. School-age children may see this as punishment for something they have done. Tub bathing may be counterindicated. Between the ages of 3 and 6, the child is curious about sexual differences, and surgery at this time may cause negative impact on the growth and development of the child. Questions. The administration of prednisone to a child with nephrosis creates a problem of increased risk of infection. B. A priority nursing responsibility in the care of a child with Wilms tumor is to. It's again B. Okay. That brings us to the end of this lecture. I know it's a lot of information, but if like this guy says, if you don't study, you shall not pass. So study it hard. We'll be doing other things. Be safe. I'll see you when I can see you. All right. Bye.